One key angle investigators are looking at is the mental health of the suspect. That's after a prior incident where the suspect entered a plea of not guilty by reason of insanity. This tragedy is once again shedding light on a growing need for mental health resources. News Channel 3's Autumn Pitcher joins us live in Kalamazoo tonight with more on this mental health crisis. Autumn?
Yes, Jessica, it's like a domino effect. Hospital emergency departments are overcrowding with mental health patients, and there is a shortage of beds in state psychiatric hospitals. That's why Michigan prosecutors say a lot of these behavioral health patients end up on the streets, and a lot of them make poor decisions, which can ultimately end in them being in the criminal justice system. Brant Gauthier, president of the National Alliance on Mental Illness, says incidents like the stabbing at the Traverse City Walmart happen when behavioral health needs are not properly addressed.
People are slipping through the cracks. There's just not enough access. People don't know where to turn to.
Emergency departments are overcrowding, and Gauthier says there is not enough beds in state psychiatric hospitals.
So we have some people who are driving hours to try to find access to care or inpatient services.
The family of the stabbing suspect, 42-year-old Bradford Gille, says they spent nearly 3 decades trying to find him a long-term mental health facility.
He would get into a temporary spot, get medicated for a little bit, and start doing really good, showed good signs to the doctors, and they said, well, we have no reason to hold him. He's doing good.
But when there's a lapse in care for people who might need it, Director of Justice Services with Integrated Services of Kalamazoo, Lindsay O'Neill, says people can end up on the street and oftentimes in jail.
We have entire wings of the jail now that are dedicated to these individuals.
She says 10 to 15% of inmates at the Kalamazoo County Jail are mentally ill, limiting space that's needed for more serious criminals.
It's upwards of 20 to 40 at this point that are simply in jail because they are waiting to go receive treatment at a forensic state hospital.
In the meantime, Michigan has designated $56 million to build crisis stabilization units. They can provide a patient immediate care for up to 72 hours. The first one is being built in Kalamazoo currently right now. That is under construction. It is expected to be complete by the end of this summer. It's on Olmsted Road. And remember, if you or anyone you know finds themselves in a crisis, you can always call the Suicide Crisis Lifeline at 988. Live in Kalamazoo, Autumn Pitcher, News Channel 3.